We're now going to build a floating hospital. Amy Lehman. It's good to meet you, Amy.
Nice to meet you, too. So I need to give you all a couple of disclaimers. I think I'm actually in the wrong pod. I am a cause, I have a cause, but I'm also a skeptic and a contrarian. So much so that I have reworked what I was going to say so that I could address a number of the issues that I heard today that I felt needed to be addressed on the stage. So So it's not really intentional, my contrarianness or my rebelliousness. I think I just came out of the womb that way. And when I started doing this work in aid and development on Lake Tanganyika, and by the way, you're just going to see some photographs of the region just spooling through. I didn't set out to become sort of the bad girl of the aid and development space, but indeed, I have become that. And the other disclaimer I want to give is that I'm extremely averse to TED culture. And what do I mean by that? I mean that pre-prepared, totally rehearsed, anti-spontaneous talks, right, to me actually are very fake. The real way to learn things is to have a conversation and a dialogue, because the reality is that a lot of these issues are so incredibly complex. There's no way that in 15 minutes I could tell you something real and substantive that I would want you to take away and be like, oh God, that's true, that's true. And the other thing that I'll say is in my work, I have to talk a lot. I always have to talk. I talk to politicians, I talk to different officials, I just talk and talk and talk. But really, the most important skill in the work that I do on Lake Tanganyika is listening. And that's one of the things that I think is really absent from the aid and development space these days. It's that we don't listen to what poor people want. And we don't ask them what's really going on, and we don't ask them their opinion about how they see their lives and how they would like their lives to change. And so with that in mind, I'm just going to briefly explain what I do, and then I want to try a little experiment with you guys, which is I have 3 choices, and I want you to choose what you want me to talk about, so that it's not really a conversation exactly, but at least you have some say, right? So what do I do in a nutshell? I do health systems building in the Lake Tanganyika Basin, and I do some policy and advocacy around the Lake Tanganyika Basin, and in the course of doing both of those things, I do a tremendous amount of data collection. What's really happening? What's happening across disease? What's happening in the environmental sphere? What's happening in the fisheries, et cetera, because I think these things are all related. So I always start by talking about Lake Tanganyika, saying it's the most significant place on Earth that nobody knows anything about. Lake Tanganyika is the longest lake in the world. It's surrounded by 4 countries: the Democratic Republic of Congo, Tanzania, Burundi, and Zambia. DRC and Burundi are on the Fragile States Index and have been since foreign policy has been publishing that list. Currently, DRC is 5, Burundi is 18. It's a place where there's been 20-plus years of war and unrest. Currently, there are 100,000 new Burundian refugees who have fled because of political unrest. Lake Tanganyika contains almost as much water as all of the North American Great Lakes combined. So when I start hearing people talk about like Lake Superior and stuff, I'm like, nope. Lake Superior is a puddle compared to Lake Tanganyika. Lake Tanganyika has almost 1/5 of the world's available fresh water in it. it's a biodiversity hotspot. It has oil and gas underneath it. So I'm going to talk a little bit about energy. I have some things to say about energy. And the whole western border of Lake Tanganyika is mineral-rich eastern and southeastern Congo, so full of all those industrial minerals that go into your telephones and your computers and into your golf clubs and all that kind of stuff. So Lake Tanganyika is also home to some of the world's most vulnerable people. And in the Lake Tanganyika Basin, we have about a 25% under 5 mortality rate. So one of the things I want to say is the reason why a baby dies in the Gambia is for a multiplicity of reasons. It's not because there isn't power for it's not because there's not power for an incubator. That's a very, very tiny piece of the puzzle. What causes a 25% under 5 death rate and sky-high maternal mortality, which we have, by the way, is this complex intermixing of all kinds of issues that occur in the Lake Tanganyika Basin. And so we're talking about a place that has in environmental issues, energy issues, humanitarian issues, issues of biodiversity and environmental conservation. And how do all of these things actually intertwine with each other to help create these incredibly complex circumstances for which there are no magic bullets? That's very important to understand. It's not one thing alone. So this complex interconnected web and talking about it is actually what got me in trouble in the aid and development space in general. Because everyone kept saying, you're a doctor. Why are you talking about water? Or you're a doctor. Why are you talking about the fisheries? Maybe because 50% of all protein consumed by people in the Lake Tanganyika Basin, come from lake fish, right? And that malnutrition is a main driver of morbidity and mortality in the basin. Like, aren't these things actually all connected? And don't we all need to be talking to each other about all of these different problems? So, but this pissed people off, to be totally honest with you, because the aid and development space is constructed around vertical funding and scale. And so when I mean vertical funding, I mean I take an issue and we just ply loads of money into that one issue, but we do so in a way that we fail to see connections of that issue to lots of other issues. And the idea of scale is a very interesting one to me, especially because there is a huge difference between how we look at how we should address problems using technology and science for the rich white world and how we use technology and science to address problems for the rest of the world's poor and brown. And I'll just give you an example. Here we think it's okay and fantastic and wonderful. And by the way, I think it's fantastic and wonderful. I'm not an anti-technologist in any way. But genetic medicine and biologics and all of this very, very individualized medicine and treatment, it's very expensive. Maybe over time it will become much cheaper. But it's very, very, very expensive. But that's okay. However, what we are told by donors, by the multilateral space, by large foundations, et cetera, in general, is that we have to find the cheapest possible solution for millions of people that can be deployed in this scalable way, pennies for interventions, pills that cost fraction of pennies, things like that. And there is a kind of a cognitive dissonance for me when people say things like that, because when I talk to them about what it costs to build a regional hospital ship on Lake Tanganyika, for example, I actually had a guy at a conference I won't call out the company, and I won't call out the conference, but let's just say it's a place where the global elite get together and pat each other on the back for solving the world's problems, and in the meantime, like eating a lot of fancy food and wearing their conflict diamonds and all that jazz, okay? So the guy says to me, oh, so how much does your boat cost? And I said, oh, it costs this. And he said, oh, no. That's way too much money. I mean, if I see a poor person on the street who is starving and needs food, I will give that person food, but I am not going to give that person steak. He said that. Yeah, whoa is right. And I was like, whoa, you just said that out loud. Awesome, because I'm going to take you down right now. In my native city in Chicago, there are, two gigantic hundreds of millions of dollars of pediatric specialty hospitals that are 1.5 miles away from each other, okay? No one says, oh, is that wasteful? Oh, we shouldn't deploy money in that way. Everyone's like, that's awesome. That's so great. The hospital ship, costs a fraction of that, and it could potentially serve millions of people and help keep a health system intact. But that idea, right, somehow that you would deploy large amounts of money in this way for populations that aren't our population, seems really shocking and wrong to people. But I think it's shocking and wrong that people have that reaction. And so this idea of scalability in general is if all poor people all over the world are exactly alike and that they need all the same interventions and that one intervention that works in one place is going to work in another. And so this kind of siloed mentality of choosing issues and almost being in intense competition with each other for funding and things like that. It actually creates a very, infelicitous working environment. And do-gooders can be nasty, just like nasty, mean people can be nasty. Like, everyone can be nasty if you set up a set of incentives, right, that draw out certain kinds of behaviors. So no one really likes it when I talk about things like that, which I do all the time. But I'm sorry, now I have to go back to the experiment, which is to give you a choice, okay? Because we only have 5 minutes here. All right. So, do you want to talk about choice number 1? Why should we build a hospital ship on Lake Tanganyika? That's choice number 1. Choice number 2, this is a good one. I might want to push you towards this one. Choice number 2, why is the misuse of mosquito bed nets a parable for how hard it is to do aid and development? It's a very interesting story, okay? Choice number 3, why do we set polar opposite standards and expectation in health for us in the West versus the poor black and brown everywhere else in the world? Okay, 1. Who wants 1? Okay, just 1. Okay, well, you can read about that, why we should build the hospital ship on our website. There's a lot of information about that. I talk about that all the time. Okay, number 2, bed net misuse. Okay, I think bed net misuse, but I'll be for completeness. Number 3. 2 or 3? 2. Okay, well, I'm going to talk about 2 because I can talk about 3 embedded in 2, okay, because it's about the same thing in a way. Okay, so bed nets are a panacea against malaria, right? Yes. Well, turns out in water-based communities that might not be true. We did a study that showed that 86% of households on the Tanzanian side of Lake Tanganyika reported using their bed net to fish at least once per day, 86% of them. And this is in the face of the malaria community saying, there is no evidence that bed net misuse is taking place. And I was like, oh. Okay, so we presented this evidence at the Large Malaria Partners meeting in Geneva, Switzerland, and everyone was like, oh my God, you know, and everyone was like kind of upset and stressed out about that. And we weren't saying bed nets are bad. We were saying maybe the story here in this giant lake where there are a bunch of competing problems, maybe the story is more nuanced than that, and we need to get more data and more information. So everyone was like, and then crickets. Nobody wanted to find out more about this problem. And that was stunning to me because I'm a doctor, okay? Malaria is the #1 cause of death in the Lake Tanganyika Basin. And I really am invested in figuring out ways to prevent malaria as well as treat malaria. So then what happened is that the New York Times picked up this piece. And the editor for the Times, who does all the East Africa coverage, was so taken with this story that that person sent the journalist around all over to Madagascar, to Zambia, to Lake Victoria, and found out that bed net misuse is actually a very common problem in water-based communities. And so what happens when people fish their bed net? Well, a couple of things. One is that the bed net is impregnated with permethrin, which is actually a water-soluble and carcinogenic substance. So you dip it in the water, okay, and the permethrin comes out. The other thing is that fisheries have very profound rules that are based on science. About where you can fish and about how large a gauge a bed net, you know, or fishing net you can use. So bed nets, right, have a tiny gauge because they're intended to keep out mosquitoes. So if you can imagine, that's a net that's catching everything, right? So it also turns out that in the Lake Tanganyika, in the hundreds of species of fish in Lake Tanganyika, all but 5 of them spawn by the edge of the water. All of them but 5 spawn by the edge of the water. So we take this very tiny gauge net that also happens to leach out poison, and we use it along the edge of the water, and we fish out tubs and tubs and tubs of baby fish fry. What happens to the fishery when that happens? Right? And so for me, we were looking at a number of things. We were looking at, hey, the malaria rate hasn't dropped after these bed net distributions happened. You know, people are dropping dead like flies. It's a humanitarian disaster, malaria is. So it's not working, right, in its primary objective. And we're creating these unintended consequences in fisheries and in people's livelihoods. So what does that say about this particular intervention in this part of the world? So for me, this is a parable, actually, about how hard it is to do aid and development, how hard it is to do systems design, which is why it's not the electricity and the incubator for the baby, right, in sub-Saharan Africa. It's this whole range of things that are happening, as well as asking ourselves the question, is it an appropriate, this is super controversial, by the way, and I'm not like a death panelist or anything like that, but I want to actually pose the question, should we automatically say, it's great that we spent maybe $3 million, between $2 and $3 million, on the life of one white, ultra-preemie baby, right? And we don't want to spend money to build the appropriate infrastructure for millions of people. I think we need to ask ourselves that question. What is health justice? What is environmental justice? Who gets a voice? Who says what's going on in their own lives? And are we prepared to listen? Because those things to me are non-obvious, and I think that this complex world that we live in couldn't be better illustrated than in the Lake Tanganyika Basin, where all of these ties are made explicitly clear, I think. So I'm out of time, and I won't say anything more controversial. Thanks.
Hang on a second. I have a confession to make. I slipped Amy a couple of extra minutes on the computer. Because in particular, I share with her opinion about that self-congratulatory, smug elite out there who are busy saving us whether we need it or not. Thank you very much, Amy.
Thank you, and thanks for the extra time. Also, tip, Google Amy Lehman tattoo. It's a Google search term, and you will see the entire map of Lake Tanganyika tattooed.